Hello.
Hi.
Mr. Monroe?
Yes.
How is it going?
Pretty good.
Good. It's very nice to meet you.
Thank you.
Looks like you got settled into your gown and everything okay.
Yes, I did.
Welcome to the research facility.
Thank you.
Did you have a chance to do your tour and have a look around?
I did.
Perfect.
It's very exciting. I can't wait to get started.
Good.
Yeah.
Thank you so much for joining our program. You are a volunteer and we appreciate your time. Essentially, what we'll be doing in this program is testing some neurological functions. So this is a cerebral, vascular, and neurological research program. Today is day one of the program, so welcome to day one. And this is Baby Cat, correct?
This is Baby Cat,
welcome.
yes.
We were happy to allow you to bring her with you.
Yeah.
Thank you so much for coming in. So essentially, we're going to be performing a series of tests and assessments, and we will be kind of testing the effects of certain external stimuli and stressors, like specific stressors and triggers on neurological function and cerebral triggers. So we're trying to look at if we produce specific stimuli onto a person, how does it affect them cardiovascularly? Does it affect their lung health? That kind of thing. So we'll be doing a series of assessments, testing your vital signs, retesting, and I will go over everything step by step as we go through. We want you to be as informed as possible, okay?
All right, sounds good.
Are you comfortable so far? Because we will be here for at least the next hour, so I want to make sure that you are as comfortable as possible before we get started.
Yes, I am.
Okay. All right, well, if we could go ahead and jump in. My name is Dr. Perez. I will be the neurologist conducting this assessment. Serena is in the room with us. I'm sure you've already met her. So she is the sonographer. She is also my personal scribe. You will hear her typing. I may talk to her every now and then. She's taking notes for me and I just need to communicate certain things with her. So she will be here. If you have any questions, you can ask either one of us, and then you are aware that this session is being recorded just for research purposes.
That's fine.
Okay, perfect. And I believe we have your consent for that on file already. Okay, so if we can just get started with a few basic things. I do need you to confirm your first and last name for me.
Sure. James Monroe.
Perfect. And your age?
I am 33 years old.
Perfect. And I have that you are a male at birth.
Yes.
Okay. And you are aware that you're here for neurological research.
Yes, I am.
So I'm going to start with a couple preliminary assessment questions, and they're just kind of getting a baseline for how you are feeling today and whether or not that would disqualify you from this assessment. Okay? So there's no wrong answers in any of this exam. Everything is just kind of putting different questions together, and we'll graph it later on, and it all kind of comes together to make a little bit more sense.
Okay.
So can you tell me your current pain level on a scale of 1 to 10, and 1 would be little to no pain, 10 would be the maximum amount of unbearable pain?
Okay. My pain level is a 1.
Perfect. Are you experiencing any numbness, tingling, or burning anywhere on your body?
No, I am not.
Okay. Do you feel generally well or generally sick at this present time?
At this present time, I feel generally well.
Okay. Any abnormal symptoms in the last 2 weeks? That could be cough, cold symptoms, flu symptoms, headache that's maybe abnormal to your baseline, any issues with your gait or your walking, changes in ambulation, absolutely any difference in your health that you've noticed in the last 2 weeks?
No, none at all.
Any contact with sick individuals in the last 2 weeks?
No, none at all.
Okay. And any surgeries in the last 2 years?
No.
So we did just have the one oral surgery on file from you for 6 years ago, and that's still current.
Yeah, that was just wisdom teeth. Yeah, 6 years ago.
Perfect. Did you get all of that? Perfect. So I'm taking notes here as well as she is scribing for me electronically.
Okay.
So the first thing I want to do is get a set of preliminary vital signs. So we're testing multiple things here. I want to see if there's any change in your vital signs, if your blood pressure is elevated, if your oxygenation decreases, if your pulse is elevated, any changes that would occur internally after the stimulus is tested. So basically we'll get a preliminary set of your vital signs so we have a baseline of how you're feeling. If you start to feel any anxiety or anything like that, I do want you to let me know. That's something that we'll go over here in a second. But this set is just kind of letting us know how you're doing while you're resting, and you've been sitting for at least 20 minutes, so they should be kind of at your resting baseline, okay?
Okay,
So let me set this down for just a second.
cool. All right.
Can I get you anything before we get started with the actual examination? Do you need any water, anything to drink?
No, I think I'm okay.
Okay. If at any point you feel like you do need something, you just let us know and we'll have someone grab it for you, okay?
Sure.
So I have a couple different tools here. Since our friend left, I will set it down.
Okay.
And I'm gonna start by just testing your temperature in a couple different places. So I know this looks a little odd. I don't have to touch you with it, but I will in some areas just to make sure that we're getting an accurate reading. So just make sure that it's on. Perfect, okay. So you can just rest for a second. Perfect. Good. Looking for any abnormalities. Temperature abnormalities, perfect. I'm just going to change the setting quickly. This time I will be touching it to your head.
Okay.
Good. Perfect. And essentially looking for an average reading. If I could have you hold your arms out, I'm going to test just on the inner elbow. Good. Good. Okay. So I will go ahead and input those numbers. Getting about an average of 97.9, which is within normal limits. Okay. So what I'm going to do now, James, is place this on your finger. So if I can have you stick out your left index finger, we'll place that there. And let's rest your arm down here. And we'll get that connected, and then we'll go ahead and get your oxygen read. This is a blood pressure cuff, and it is meant to be used on the lower arm. Okay, so if I can have you stick your arm out for me. Nice, comfortable right here. Looking on the lower arm. Perfect. So I want you to relax your arm just like this. I'll have you hold this for just 1 second.
Sure.
Just going to place my stethoscope. And the device you're holding is called a sphygmomanometer. And just going to help me read your blood pressure. Okay, so I will take that from you and I'll help you sit just the way you are. Take regular breaths for me. I'm going to place this on the inside of your wrist, okay? Perfect, so starting blood pressure is 135/82, which is within normal limits.
Okay.
It's perfectly acceptable. Let me just write that down before I forget.
Okay.
Perfect. And according to your oxygen sensor there, your oxygenation is 98%, which is amazing. Respirations are at about 18 and your pulse 87. So everything so far looks good. Everything is within normal limits.
Okay.
Nothing is out of norm. So we are okay to proceed. So I will take this off. And we will be using this multiple times throughout the test, so I'll keep it close by. Okay, perfect. All right, Serena, are you ready? Okay, so I had the temp is 97.9 Fahrenheit. Oxygen levels are 98%. His pulse is 87, respirations are 18, and systolic is 135, diastolic is 82, and MAP 69. Perfect, okay. All right, just making sure we are on the same page. So what we're going to do now is get started with the neurological portion of the assessment. So all of it is kind of cerebral related, so it's all going to be questions that might affect your mentation, but this portion of the exam specifically is to do with the neurological portion, okay?
Okay.
So this is called an MMSE, or a mini mental status examination. So testing a multiple variety of things. Some of it might seem kind of convoluted, some of it might seem a little bit elementary and too simple even, but it does have a purpose, so I don't want you to think we're just asking you silly questions for no reason. It all kind of comes together.
Right.
So the first portion of the examination is going to be testing your orientation, looking for function of awareness, essentially. So can you tell me verbally the date, month, and year?
Okay. November 1st, 2023.
Perfect. Can you also verbalize the city, state, and hospital that we are located?
Yes, we are in Jacksonville, Florida, and we are in Jefferson University Hospital.
Perfect. Okay, so let's move on to testing some registration. This is testing your ability to kind of acknowledge and understand or register specific information, okay?
Okay.
So I am going to verbalize 3 words. I want you to repeat them back to me in the order that I say them.
Okay.
Door, book, table.
Door, book, table.
Perfect. Now repeat them one more time, and this time I want you to recall the information because I will be asking you to repeat them later on in the examination.
Okay. Door, book, table.
Perfect. Okay, so we're moving on to test your attention and calculation.
Okay.
So this portion of the exam is testing your ability to pay a reasonable amount of attention to verbal direction,
Okay.
as well as your ability to solve age-appropriate calculations. So they might seem a little elementary, like I said, but you should be able to solve them within reason.
All right.
So for the first one, I want you to spell the word world backwards.
Okay. DLROW.
Very good. Can you spell it forwards?
Yes. WORLD.
Very good. Can you count to 18 in a sequence of 3, starting with
Sure.
3?
3, 6, 9, 12, 15, 18.
Perfect. Now I want you to solve this series of equations
Okay.
verbally. 6 plus 12 equals,
6 plus 12 equals 18.
good. 18 minus 6 equals,
18 minus 6 equals 12.
very good. And what number would you say the last 2 equations had in common?
12.
Good. Can you recall the previously stated objects?
Book, table, door.
Very good. Okay. And you will have to recall those again. So
Okay.
let's try to remember door,
Put them to the
book,
side.
table. Okay. Okay, so moving on to testing language. Not your ability to speak a language, more so linguistic function. So we're assessing speech patterns, linguistic function, as well as your facial muscle tone and the way that you move your mouth as you verbalize words. So can you tell me what this object here is?
Yes, a pen.
And this?
A clipboard.
Good. Now I'm going to hand you the pen and the clipboard. On this line next to the asterisk, I want you to write a complete sentence, any sentence you would like, obviously preferably an appropriate sentence, but whatever you would like as long as it's complete. Please include proper punctuation and spelling. Thank you.
Sure.
Okay, you must be a Transformers fan. When the Autobots return, I'm going with them.
Yes.
Okay, that's an appropriate sentence. I will take it. All right, thank you. And I'm going to have you repeat another series of words. You will not have to remember them this time.
Okay.
Can you say no ifs, ands, or buts?
No ifs, ands, or buts.
Perfect. Excuse me. Okay, so moving on to testing your executive function. So we are now assessing your ability to plan, organize, and execute specific tasks, okay? So I want you to copy this design in this space, just exactly the way that it is.
Sure.
Good. And can you now make that a 3D object?
Sure.
And can you tell me what that is?
That's a cube.
Perfect. And this here is called?
A square.
Good. So I'll let you keep the pen for now. In this space, I want you to draw any shape around the same size as this one.
Okay. Inside of it?
Here.
Okay.
Good. Can you draw another shape on the outside of that shape? And another shape on the inside of the first one. Very good. Okay, thank you. We have now completed the MMSE, so let's go ahead and move on to the repetition of your vital signs.
Okay.
And this is just to test for any changes that might have occurred given that we did place a reasonable amount of stress on your brain. So we will redo this. How are you feeling?
I'm fine.
Any change in your anxiety levels?
No, I don't feel stressed.
Okay. No pain, anything abnormal that wasn't there before we started the examination, correct?
No. That is
Do you
correct.
have any questions so far?
I don't think so.
Perfect. So I am going to place this on your finger once again. Perfect. Just relax your hand down for me. Thank you. Good. Okay. Once again, testing your blood pressure. Just take normal breaths. Okay. 140 over 83. Excuse me, so we did see a slight jump in your systolic.
Okay.
So just something to note, could be coincidental, could be that the test has put just a little bit of pressure on you. We do expect to see slight increases in this test. Like I said, there are no wrong answers. All of this is just going to allow us to put together a graph of information later on.
Okay.
Just going to test your temperature once again. Okay. Body temperature actually went down by 1 degree. So allow me to just notate all of that. All right, Serena, are you ready? Perfect. So I have temperature is 97.6. Oxygen was 98% once again. Pulse 84. So actually went down slightly. Respirations were 18. They remain the same. Systolic was 140, diastolic 83. Okay? Okay. So I am going to go ahead and take my stethoscope out actually. So the next portion of our examination is going to be testing your heart and lungs. So I just want to have a listen to your cardiovascular system, okay?
All right.
So I am going to be coming fairly close to you. Is it okay if I pull the gown down just slightly? Okay. And allow me a little bit closer access to you. Okay. Go ahead and undo this side as well. I'm just exposing the top of the chest area here, okay? So I want you to just take normal breaths to start with.
Sure.
Perfect. So I'm going to place this on your carotid arteries. I want you to breathe in and hold your breath, okay? So breathe in and hold. Good. Same thing on this side. Breathe in and hold. Perfect. Just breathe normally. Perfect. So now I'm just going to reach around the back, use the bell side to listen to your lungs.
Okay.
Just breathe normally. Good. I can have you sit up straight for me. There's a little pocket on the side of your gown here. Just going to reach in with my stethoscope and listen to your abdomen. Same thing on this side. Good. Okay. So all of that sounds pretty normal. I'm sure you can hear it overhead. So that kind of rhythmic beating is what we want to hear. There was no signs of any kind of flutter or palpitations, which is good.
Okay.
Allow me to just catch up on a couple of notes here. So, if you can just make sure that you chart rhythm and rate. I would say normal sinus. Thank you. Okay, so let's go ahead and move on to the second portion of the neurological examination.
Okay.
So this is going to be a CVAA, or a cerebral vascular accident assessment.
Okay.
So it's essentially a stroke assessment, but we're using it a little bit differently today. It's just another source of external stimuli that will allow us to test the differences in your neurological function, okay?
All right.
All right, so once again, I'm gonna have you attempt to restate those previously recalled objects. Do you remember what they are?
Let's see. Door, book, table.
Very good, that is correct. So now I'm going to have you close your eyes. I'm going to place an object in your hand, and I want you to try and tell me what it is with your eyes closed. So if you can hold your left hand out for me. You can feel around, tell me what that is.
Paper clip.
Okay. In your right hand.
Pen.
Very good. Thank you. Okay. So I have a few objects that I will be utilizing for the next portion of the examination. Give me just a second.
Okay.
Okay, so let's start with these. I am going to hold these out, and I want you to take them from me and place them in your hands in order of what you would consider darkest to lightest.
Okay. Might switch this. I might change it. The gray is kind of throwing me off a little bit, but we'll cross that bridge when we get there. Alright. Something like this.
So give me just a second while I document your choices. Okay. Excuse me.
I would maybe move the gray by the purple.
Okay. So gray in front of purple instead.
Yeah.
Okay. Now I would like you to pull any that are the same color.
These reds. These wobs. That's it.
Okay. Are there any left that you would say are in the same color family?
Yeah, these two greens is like a mint green and an emerald green. And we have maybe a fuchsia and a lavender.
Very good. Okay. So I will take these from you.
Sure.
And similar test here with these objects. Excuse me while I just get them ready.
Okay.
Now, can you tell me what color here is closest to blue and pull that color?
Yes.
Good. Of the colors that are left, can you please pull the two that best suit green and blue? What color is left?
Pink.
I'll take these from you. We will come back to those later. Did you catch the change of the gray to the purple? Yes. After? Mm-hmm. Thank you. Just making sure we don't miss anything.
That's fine.
Excuse me. So I am going to give you a verbal scenario and I want you to just react accordingly, okay?
Okay.
So, scenario is going to involve bears. They are fictional, so they will have human-like thoughts, which obviously is abnormal, so just take it as it is. So 3 bears are in the woods. They walk towards a man. What action could that man take that would most likely ensure his safety?
For him
You
to...
can give me multiple options.
Okay.
For him to survive.
Okay. Possibly play dead.
Okay.
He could make a lot of noise and try to scare them away. If he has any type of food with them, he can maybe throw the food down and slowly back away and hope that they'll go for the food and leave him alone.
Okay. Is there anything he should not do?
He should not take off running.
Very good. And can you tell me why that would be a bad idea in this instance?
They would likely chase him.
Good. Okay. So your ability to kind of assess and evaluate a situation where there is danger is appropriate.
Okay.
Okay. Very good, James. Very good. Okay. So we are going to move on to the physical portion of the examination.
Okay.
Do you need a break prior to?
No, I'm okay.
Okay. So we're going to get started with an eye exam. Before we do that, just so that I can get these tools out of the way, I'm going to perform a very brief strength test. So I'm going to hand you an object and I want you to just repeat after me. So you take this in your hands, hold it at the ends with your index and thumb.
Okay.
I want you to pull away from you until your wrists are parallel to your elbows. Perfect. So go ahead and return. I'm going to hand you another one. Repeat the same test with both of them. Perfect. And again, repeat the same test. Good. So as you can tell, it's getting increasingly difficult.
Yes.
So try to keep elbows at your sides. Bring your wrists to your elbows. There you go. Good. Okay, and now I want you to attempt with the full grasp of your wrist. So hold it like this and see how far you can go. Perfect, okay. Thank you. So that was just testing some strength and resistance.
Okay.
The bands are graded, so the different colors have different resistance, and you were able to pull it appropriately according to your age and what your strength level should be. So I will go ahead and put this away. So we are going to move on to an eye exam, okay?
All right.
So the first thing I'm going to do actually is dim the lights.
Okay.
I'm going to be testing your pupillary reaction. So I'm going to dim the lights so that I can just kind of better visualize your pupils.
Okay.
Excuse me while I just turn this off. So going to turn these off. Can you still see me okay?
Yes, I can.
Perfect. So for this portion of the exam, now I just want you to look straight ahead, okay? I'm going to be coming fairly close to you. Is that okay?
That's fine.
Do you still have good visualization? Alrighty, so I'm going to bring the light up into your visual field. Just look straight ahead for me. You wear these glasses more than 90% in a 24-hour period, correct?
Yes, I do.
Okay. Pupillary reaction is normal. So right now, I would say we're at about a +2 on both sides. So I'm just going to include one side I'll be covering with my hand.
Okay.
Good. Constriction and dilation are both normal. Okay. So now what I'm going to have you do is follow the light with
Okay.
just your eyes.
All right.
Try not to move your head, okay?
Sure.
Good, good. Very good. Okay. James, any pain or discomfort with any of that? Did you feel any pressure build up behind your eyes?
No, I didn't.
Thank you. So I'm going to go ahead and turn the lights back on.
Okay.
Okay. Give your eyes a second to adjust. You ready?
Yes.
I'm going to visualize different parts of your orbital anatomy. So if I can have you look all the way up, I'm just going to be placing my hands on your forehead to stabilize. And if you can look down and all the way that way and all the way to the right. Just 1 second. To the right for me. Yeah, so right now if you could just notate a 3 millimeter discoloration in the vessel in the right eye on the left side, midline to the pupil. I would say it's brown in color. Does not extend to the orbital socket. Thank you. Thank you. So just a slight discoloration there in the eye. Nothing too abnormal, but it is something that I want to make sure we have documented, okay? So now I'm going to go in with this tool, and this is called an ophthalmoscope. And this is going to allow me to visualize your optic nerve, which is the nerve in the back of your eye.
Okay.
So I'm going to be getting very, very close to your face.
Okay.
And I would like you to just look at that point on the wall. You see the green circle?
Yes.
Just look straight there for me.
Okay.
all the way to the left for me, eyes wide. Very good. Okay. Do the same thing on the other side. You're doing great. And eyes wide, 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 all the way to the right. Good. Okay. You can just look directly at me. Good. Okay, very good. So no abnormalities noted with your optic nerve. Optic disc is intact. No perforations noted. Okay. So the next thing I'm going to do is test for visual acuity, and this is just a very brief test just to make sure that when we move on to day 3 and 4, you will have your glasses with you and will know that you're able to read the correct materials. Day 2 is a little bit different, but day 3 and 4 you will be needing to read something. Okay.
Okay.
So can you see this test as a whole? You're able to see the Snellen chart in its entirety?
Yes, I can.
Okay. So I'm going to step back just slightly,
Mm-hmm.
and I want you to tell me what this letter here is.
E.
Good. And here?
F. P. T. O. Z.
Good. So I'm going to move to this side just to give you better visualization of the smaller letters.
Okay.
You see this here?
Yes. L. P. E. D. P. E. C. F. D. E. D. F. C. Z. P. F. E. L. O. P. Z. D.
Are you able to read the smallest line here?
Yes. P. E. Z. O. L. C. F. T. D.
So now, just to make this slightly more difficult, I want you to occlude either side.
Okay.
Are you able to visualize the smallest line?
Yes. P. E. Z. O. L. C. F. T. D.
And if you'll switch eyes.
Sure. P. E. Z. O. L. C. F. T. D.
Perfect. Okay. So as long as you have your glasses with you, you'll be able to adequately perform for test days 3 and 4. Okay. So following up with that, we're going to do a brief test for color deficiencies, and these are called Ishihara test plates,
Okay.
testing your ability to see color. So can you see this picture as a whole?
Yes, I can.
What number is this?
Number 12. Number 8. Number 5.
Good.
Number 29.
Good.
74.
Good.
Number 7.
Good.
45.
Good.
Number 2. And just a pattern there. Number 16. And another pattern.
Maybe you take this tool,
Yes.
trace the pattern from start to finish for me.
Sure.
Very good.
35 and 96. Another pattern.
Can you tell me what color you see here?
Black and gray. Purple, red, pink. Red.
This lightest color here.
Orange.
Good. So no suspicion of color deficiency or color blindness, and your visual acuity was all within normal limits. Okay. Oh, that is very good. And let's move on to testing your peripheral vision. So I would like you to tell me what color this is.
Red.
And this here.
Green.
So I am going to move these in and out of your visual fields.
Okay.
And at first, I want you to tell me when you see it appear and
Okay.
when you see it disappear. So it would look something like reappears, disappears. Okay?
Okay. Should I look just straight ahead?
You should look straight ahead. I'm going to stand to the side of you to give me the best range of motion.
Okay.
Are you ready? Okay. All right. So Serena is documenting, and we are ready.
Okay.
So just make sure you're visualizing because she will be documenting every time you respond, okay?
Yes.
So tell me initially when it appears.
Appears. Disappears.
Good.
Appears. Disappears. Appears. Disappears. Appears. Appears. Disappears. Disappear. Appear. Disappear. Appear. Disappear. Appear. Disappear. Appear. Appear. Disappear. Appear. Disappear. Appear. Appear.
Very good. Now I want you to tell me what color you see when it comes into your visual field, okay?
Okay. Red. Red. Green. 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 Red. Green. Red. Green. Red and green. Red and green. Red. Green. Red.
Perfect. Very good response time. Okay, so your periphery was all normal. Peripheral vision is within normal limits. There were no signs or symptoms of stachoma, which would be a blind spot.
Okay.
Visual acuity is 20/20 with glasses on. So Serena, just make sure we have it documented that he does need to be wearing. Perfect. Okay. All right, Mr. Monroe, so we are moving on to a very brief examination of your ears and hearing.
Okay.
Give me just a second while I switch on my tools here.
Okay.
I am going to be using an otoscope to visualize the ear canal, as well as the external and internal meatus and your tympanic membrane or eardrum. Okay? So again, coming very close to your face. I can have you turn your head. Very good. This might be slightly uncomfortable. It is very cold, okay? Just insert. It is cold, I apologize. Inserting the tip into the ear canal, and good, I am able to visualize tympanic membrane. So I'm going to release for just a second. If I can have you tilt your head slightly.
Sure.
Here, perfect. And reinserting. Okay. Good. Okay, Serena, so I'm not seeing any excessive rumen. Very small dislodged amount. Normal waxy material. Normal in color, it is a golden brown. Tympanic membrane is pearly white. Very good. Normal hair distribution. Perfect. Okay. Okay, so same thing. Inserting. Okay. Again, tympanic membrane is intact, no signs of perforation. It is pearly white. Slightly less rumen on this side. Ear canal is clean. And as I exit, hair growth is normal. No signs of any lesions. Perfect. Okay. All right, James. I apologize if that was uncomfortable.
That's okay.
You were doing very well. Okay, so I will be performing a brief hearing exam. And for this, I'm going to apply a pair of gloves.
Okay.
So we'll be doing doing just some quick palpations of your ear. Touch around your ear to start, and I want you to tell me if any of this is painful or uncomfortable. So I tug and pull here. Is any of this causing you any pain?
No.
So I put pressure on the pinna here. Any pain or discomfort?
No, no pain.
No pain or discomfort here.
No.
Same with this ear as I pull. No pain or discomfort.
No.
Here and here.
No.
Good. Okay. So starting with the hearing test, I want you to look straight ahead with your head, eyes closed. I want you to say left or right audibly so that Serena can hear you. As you hear a sound, come on either side, okay? So this would be left, and we'll go ahead and get started.
All right. Right. Left. Right. Right. Left. Left. Right. Left. Right. Both. Both. Right. Left. Right. Left. 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 Right. 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 Left. Left.
Very good. Okay. So going in with a little tool here, I'm going to make a very slight tapping sound. I want you to tell me how many times you hear the sound, okay?
Yes. 3, 4, 1, 1, 1, 2, 3, 3, 3, 2, 2, 2, 3, 6,
Good.
2, 2, 2.
Very good, okay. So no abnormalities there. Okay, we are almost done with the examination today, James. So I am going to do some palpations of your lymph nodes. And before I do that, I'm just going to visualize the area.
Sure.
So I'm going to be using my pen light to have a look at your kind of sides of your face as well as your neck and chest, okay?
All right.
So just looking for any signs of abnormal edema or swelling in the glands, specifically around the bottom of the neck as well as the clavicle. Essentially looking for any signs of infection that could inhibit the results of our research. Is it alright if I just pull the gown down once again?
Sure.
Just allows for better visualization. So you're going to feel me palpate along your clavicle. discomfort with any of this, James?
No, not at all.
All of that appears to be normal. Can I have you open and close? And one more time. Good. Okay. So while I have this down, I'm going to just briefly repeat our cardiovascular assessment. Just listening for any changes in rate or rhythm. Yeah, slight increase. I would still say he's a normal sinus, slightly tacky. Mm-hmm. So Serena did note some slight increases there, but nothing that would be on the spectrum of abnormal. Let's go ahead and do some repeat temperature checks. Okay. So we did get an increase there. So you're currently at 98.1, which is a slight increase from the last time we tested. Okay. So respirations are about 21. Yeah. 87. All right, James. So the last thing that we need to test today is just some ocular reflexes. So I have a couple different tools here. They are very delicate. They won't cause you any pain, but they can be just slightly uncomfortable. So just testing the reflexes in your eyes. You can leave your glasses on for this test. You don't really have to do anything for this portion. Just kind of react normally. I'm just testing your blink reflex essentially, okay?
All right.
So if you're ticklish, I do apologize. Just need to see if there's any delay in reaction that could affect the research results. It's ticklish, I apologize. Okay. Can you close your eyes for me for just a second? Good. Very strong reactions. Okay, so this time I'm going to test with your eyes open. Okay. And this little wispy guy is going to touch your eyeball. Okay. And it's going to be a little uncomfortable, but it won't hurt. Right. So just allow yourself to react normally. Okay. Good. Good. Okay. Everybody has a natural reaction when something comes towards their eye, so just making sure that all of that is intact. Okay. All right, James, well, the good news is that concludes our examination today. So
Okay.
day 1 of research is complete. Congratulations.
Thank you.
And I do want to extend a warm thank you once again for participating in this program.
Sure.
It is vital to our statistics and our research reasoning, and all of the information that we're going to put together after this is very helpful for the healthcare system in general, so we really appreciate it.
Thank you. Glad to be a part of it.
So I will, yes, the innovation. I'm going to allow Serena to catch up on a couple of notes.
Okay.
Give us about 5 minutes, and then we will give you your clothes that you can change into for the night, and then we'll welcome you back for day 2 of research tomorrow.
All right, awesome.
Okay, get some sleep.
Thank you so much.
Thank you.
Mhm.